Good morning to all. Today I am going to discuss about fractures of femur shaft. So my name is Dr. Prem Rajesh, Assistant Professor of Orthopedics. So today I am going to discuss about anatomy and pathological of the fracture, symptoms and signs of fractures of femur, diagnosis, treatment and also complications following fractures of femur. So coming to anatomy and pathology of fracture, the most common fracture which is caused in the proximal fragment will be due to flexion, abduction and external rotation injuries. Distal fragment fracture usually occurs due to adduction injuries. So the most common cause of fractures of femur will be the road traffic accidents, which is due to rash and inappropriate driving behavior. The second most common cause will be fall from the height. So when the patient is falling from the height, they will be mostly developing Mason type 1 and type 2 fractures, and also osteomyelitis. If the patient is having any infections in the bone, it can also cause pathological fractures due to osteomyelitis. And also fall from height most commonly also occurs in the age group who are less than 18 years of age. What are the symptoms and signs following fractures of femur? The most common symptoms in which patient presents to us will be pain over the thigh, swelling will be there, and also deformity. There also will be restriction of movements in the nearby joints. So the nearby joints will be knee joint and ankle, and also the movements will be restricted in the hip joint. So patient, when we elicit the signs, will be on examination tenderness will be present over the thigh region and also hip joint. Sometimes crepitus will be seen when there is multiple comminuted fractures. Also abnormal mobility due to the fracture at the fracture site. Also patient will be having shortening or lengthening based on the type of fracture of femur. So all this will be the signs of fractures of femur. So how will you diagnose the fracture? The first and foremost basic investigation of choice will be X-ray of the injured thigh with one joint above and one joint below. That is X-ray of the hip joint, pelvis with both hips we can take to rule out any neck of femur fracture or intertrochanteric. Also shaft, also knee joint should be always covered when we are examining, taking the X-ray. So X-ray of the joint will always able to diagnose the fracture. So this is the picture showing X-ray, that is AP, anteroposterior and lateral view, showing the fracture in the shaft of femur bone. So in this case X-ray of left thigh along with left hip joint both are taken. Also left knee joint also taken, showing the fracture of shaft of femur. So what is the treatment of choice for fractures of femur bone? The treatment options are always divided into conservative options, which are non-operative, and also surgical options. So conservative options can be plaster application, that is plaster of Paris application can be done, and also spica casting can be done. So this is conservative treatment when it comes to children. So in case of children, we can always go ahead of conservative treatment. The first picture is showing bilateral long leg hip spica cast, and also second picture it is showing 1.5 hip spica cast which is applied partially. So this is conservative mode of treatment using plaster of Paris in case of children. The second picture is showing above knee POP slab in case of adults. If there is minimal displacement of fracture in adults, we can always go ahead and take above knee plaster of Paris application when it comes to adult conservative treatment methods. So coming to operative treatment, there can be two methods of treatment used in treatment of femur fracture, that is shaft. First will be plating. So plating will be done by open reduction and also internal fixation. So we will open the fracture site and fix it with plate and osteosynthesis. This is known as plating. And second operative treatment will be nailing. So nailing is mostly commonly done in children, that is TENS nailing, which is a titanium elastic nailing system. And in adults, open reduction and internal fixation is done using intermedullary interlocking nails. So these are the nailing methods of choice in fractures of femur. So this picture is showing TENS nailing, that is titanium elastic nailing system, which is commonly used in case of children, where the nails are passed and fracture is reduced. So this is titanium elastic nailing system. So coming to the second method, which is open reduction and internal fixation of the fracture. In this first picture, there is fracture in the shaft of femur, which is mostly osteoporotic bone. It is fixed using locking compression plate by open reduction and internal fixation. The second picture, you are seeing nailing system, that is intramedullary interlocking nail, which is done in closed procedure in case of young patients. So coming to what are the complications following fractures of femur fracture. So what are the complications which can lead on to this? So most common complications will be non-union, which is when the fracture is non-united, it is going in for non-union. Second most common complication will be malunion. If the fracture is not reduced properly, it can go on for malunion. The third complication will be delayed union, and fourth will be shock. So if the patient is not attended properly, femur fracture, it can always go for shock and death. And also infection is also most common when it comes to open fracture. So when patient is coming with open fracture and it is not properly washed, it can go for infection. Fat embolism is also common due to long bone fracture. And compartment syndrome. Compartment syndrome is also one of the complications following femur fracture. Also there can be vascular injuries and nerve injuries. So nerve injuries and vascular injuries are also known complications of fractures of femur bone. Thank you.